Welcome to this movie in which I will show you how to perform analysis of lung metastases with the Imalytics Preclinical software. So let's open a built-in movie here with file create underlay lung metastases. And this shows a slice through a micro CT scan of a mouse lung which had some metastases. So with this button here you can slice through. And with this button you can zoom in. And let's open the 3D view for a moment. Here you can also zoom in and rotate it. So here you can see the ribs, the spine, the sternum, but the 3D view is not that useful right now. So let's turn it off again. You can also open other views, here a coronal view, and also slice through there, and you can jump around also here in the lung, so you can jump into the heart or here. That may be useful. So I'm going to use shortcuts in the following. You can look them up here with mouse modes. That will make you faster, but you can, when you're new, you can also use these buttons here. This button is for drawing scribbles, which I will use in a moment, and with F1 you can delete them again. Okay, so let's adjust the windowing a bit to show the lung tissue better. So let's make it more bright here, maybe from 0 to 1500. And because now we can see the lung tissue better, and we can even see the bronchi. The bronchi are these dark regions, they are filled with air. So where are the lung metastases? Let's go back and forth. And here is a big one, for example. Here is an intermediate one. And here is a small one. And I'm used to looking for them, and I know where these are, so I'm pretty fast. But if you're new, it might take a while, and what helps is to go back and forward. Because these metastases, they come and go here, like this one. They come and go when you go back and forward, but the blood vessels, like these here, which are also bright, they stay, they branch. That's how you can differentiate them. And if you found one, you can here measure the size, like this, 0.8 millimeters. On this one, 1.2. And here the big one is 1.7 millimeters in diameter. But now let's use the scribbles to segment them. So let's add a class met. Let's change the color to green. And let's now here jump to this one, zoom in. And now you can delineate this metastasis with scribbles in different slices, and press F3 to delineate it, then slice through and add more scribbles, and press F3 repeatedly, so in different views here, just until you're happy with the segmentation. And then when you're happy you can press F4 and it will be accepted. Now let's zoom out, find the second metastases, here the small one, zoom in. With F1 you can delete the scribbles, here delineate it, press F3 to combine it. Like this, here maybe a bit more of this. Just do your best and press F4 to accept it, zoom out, jump to the next metastases, zoom in again, delineate it, slice through. Here it's maybe more difficult to see in this case. Just do your best. Segment the metastases, press F3 and F4 to accept it. And now we have these 3 metastases segmented. You can actually count them here with statistics, number of components, but you have to set the input class here. Number of components, it says 3 components exist for this class. And you can make a fly-through movie here with this button, or save a screenshot. And let's activate the 3D view again, but we have to change the windowing to visualize it better. And here you can see the 3 metastases in 3D. You can make also a rotating movie with this button, and it will rotate it like this, so you can visualize the metastases in 3D. You can turn off these 2 spheres here, which is where you right click. The green sphere and the red sphere is where the crosshair is, and for movies you might want to turn it off, which you can do here. Now let's split these 3 classes in this one class into 3 other classes. Just create a new class, met1, and right click here. Let's pick the smallest one first, the region. Add another class, met2, right click, the region. Add another class, met3, right click, the region. And now we can delete the class met, and we have the 3 metastases in different colors. Now you can use this button here, statistics, class statistics underlay, to get the volume of the metastases here, small, medium, larger, and the brightness in the CT data. And you can select this and copy, paste it to Excel, or save it as a .csv file, which you can also open with Excel. And you can also save the segmentation here to work on it later. Okay, that's it. Thank you. Bye bye.